Enema, Wikipedia audio. An enema is the injection of fluid into the lower bowel by way of the rectum. The most frequent use of an enema is to relieve constipation or for bowel cleansing before a medical examination or procedure. In standard medicine, an enema may also be employed as a lower gastrointestinal series, to check diarrhea, as a vehicle for the administration of food, water, or medicine, as a stimulant to the general system, as a local application and, more rarely, as a means of reducing temperature, as treatment for encephalitis, and as a form of rehydration therapy in patients for whom intravenous therapy is not applicable. Enemas are used as part of some alternative health therapies, as part of sexual activities, and to administer drugs for recreational or religious reasons. The main medical usages of enemas are: medical usage. Enemas are employed as bowel stimulants, for the same purposes as orally administered laxatives, to relieve constipation, to treat fecal impaction, to empty the colon prior to a medical procedure such as a colonoscopy. The volume of the liquid causes rapid expansion of the intestinal tract, often resulting in very uncomfortable bloating, cramping, powerful peristalsis and a feeling of extreme urgency. In the US and some other parts of the world, their use has been replaced in most professional healthcare settings by oral laxatives and laxative suppositories. In-home use of enemas for constipation is somewhat harder to measure, because of speed and supposed convenience. Enemas used for bowel emptying are commonly the more costly, sodium phosphate variety, often called a disposable enema. Once the injection is complete, the enema is retained until there is a strong urge to defecate, at which time the recipient may expel any fecal matter loosened by the instilled solution together with the solution itself. Bowel-stimulating enemas usually consist of water, which works primarily as a mechanical stimulant, or they may be made up of water with baking soda or water with a mild hand soap dissolved in it. Buffered sodium phosphate solution draws additional water from the bloodstream into the colon to increase the effectiveness of the enema, but can be rather irritating to the colon, causing intense cramping or griping. Mineral oil functions as a lubricant and stool softener, but often has the side effect of sporadic seepage from the patient's anus, which can soil undergarments for up to 24 hours. Glycerol is a specific bowel mucosa irritant, and when introduced in very dilute solution serves to induce peristalsis. Other types of enema solutions are also used, including equal parts of milk and molasses heated together to slightly above normal body temperature. In the past, castile soap was a common additive in an enema, but it has largely fallen out of use because of its irritating action in the rectum and because of the risk of chemical colitis, as well as the ready availability of other enema preparations that are more effective than soap in stimulating a bowel movement. At the opposite end of the spectrum, an isotonic saline solution is least irritating to the rectum and colon, having a neutral concentration gradient. This neither draws electrolytes from the body, as can happen with plain water, nor draws water into the colon, as will occur with phosphates. Thus, a salt water solution can be used when a longer period of retention is desired, such as to soften an impaction. In a lower gastrointestinal series, an enema that may contain barium sulfate powder or a water-soluble contrast agent is used in the radiological imaging of the bowel. Called a barium enema, such enemas are sometimes the only practical way to view the colon in a relatively safe manner. Following barium enema administration, patients often find that flushing the remaining barium with additional water, baking soda, or saline enemas helps restore normal colon activity without complications of constipation from the administration of the barium sulfate. Improper administration of an enema can cause electrolyte imbalance or ruptures to the bowel or rectal tissues, resulting in internal bleeding. However, these occurrences are rare in healthy, sober adults. Internal bleeding or rupture may leave the individual exposed to infections from intestinal bacteria. Blood resulting from tears in the colon may not always be visible, but can be distinguished if the feces are unusually dark or have a red hue. If intestinal rupture is suspected, medical assistance should be obtained immediately. Cullingworth, Charles James. A Manual of Nursing, Medical and Surgical. Cambridge, England, Cambridge University Press. ISBN 978-1-4590-1939-3, Magner, Lois. A History of Medicine. Boca Raton, Florida, CRC Press. ISBN 978-0-8247-8673-1, Parsons, Lee Allen, Carlson, John B. The Face of Ancient America, the Wally and Brenda Zalman Collection of Pre-Columbian Art. Indianapolis, Indiana, United States, Indianapolis Museum of Art. ISBN 978-0-936260-24-2. The enema tube and solution may stimulate the vagus nerve, which may trigger an arrhythmia such as bradycardia. Enemas should not be used if there is an undiagnosed abdominal pain, since the peristalsis of the bowel can cause an inflamed appendix to rupture. There are arguments both for and against colonic irrigation in people with diverticulitis, ulcerative colitis, Crohn's disease, severe or internal hemorrhoids or tumors in the rectum or colon, and its usage is not recommended soon after bowel surgery. Regular treatments should be avoided by people with heart disease or renal failure. Colonics are inappropriate for people with bowel, rectal or anal pathologies where the pathology contributes to the risk of bowel perforation. Bowel cleansing. Recent research has shown that ozone water, which is sometimes used in enemas, can immediately cause microscopic colitis. A recent case series of 11 patients with 5 deaths illustrated the danger of phosphate enemas in high-risk patients. Enema comes from Greek nu epsilon mu alpha, from nu eta mu iota, inject. Clister / also spelled glister in the 17th century, rarely cloister or clister, comes from Greek kappa lambda upsilon sigma tau rho, from kappa lambda zeta omega, wash. It is an archaic word for enema, more particularly for enemas administered using a clister syringe, that is, a syringe with a rectal nozzle and a plunger rather than a bulb. Clister syringes were used from the 17th century to the 19th century, when they were largely replaced by enema bulb syringes, box, and bags. The first mention of the enema in medical literature is in the ancient Egyptian Ebers papyrus. One of the many types of medical specialists was an IRI, the shepherd of the anus. Many medications were administered by enemas. There was a keeper of the royal rectum who may have primarily been the pharaoh's enema maker. The god Thoth, according to Egyptian mythology, invented the enema. The Olmec from their Middle Pre-Classic period through the Spanish conquest used trance-inducing substances ceremonially, and these were ingested via, among other routes, enemas administered using jars. The Maya in their late Classic Age used enemas for, at least, ritual purposes, in the Xibalban court of the god Di, whose worship included ritual cult paraphernalia. It is hypothesized that these enemas were for ritual purification and the ingestion of intoxicants and hallucinogens. The Maya illustrated the use of a characteristic enema bulb syringe by female attendants administering clysters ritually. Chronic treatments. Acute treatments. In the 2nd century CE, the Greek philosopher Celsus recommended an enema of pearl barley in milk or rose oil with butter as a nutrient for those suffering from dysentery and unable to eat, and Galen mentions enemas in several contexts. Contrast. Medication administration. Other. Adverse effects. History. In medieval times appear the first illustrations of enema equipment, a clyster syringe consisting of a tube attached to a pump-action bulb made of a pig bladder, and the 15th century simple piston syringe clysters came into use. Beginning in the 17th century, enema apparatus was chiefly designed for self-administration at home, and many were French, as enemas enjoyed wide usage in France. When clyster syringes were in use in Europe, the patient was placed in an appropriate position. A servant or apothecary would then insert the nozzle into the anus and depress the plunger, resulting in the liquid remedy being injected into the colon. Because of the embarrassment a woman might feel when showing her buttocks to a male apothecary, some contraptions were invented that blocked all from the apothecary's view except for the anal area. Another invention was syringes equipped with a special bent nozzle, which enabled self-administration, thereby eliminating the embarrassment. Society and culture. Clysters were administered for symptoms of constipation and, with more questionable effectiveness, stomach aches and other illnesses. In his early modern treatise, The Diseases of Women with Child, François Morisot records that both midwives and man-midwives commonly administered clysters to laboring mothers just prior to their delivery. In the 16th century, satirists made physicians a favorite target, resembling Molière's caricature, whose prescription for anything was clyster, bleed, purge, or purge, bleed, clyster. In Roper's biography of his father-in-law Sir Thomas More, he tells of Thomas More's eldest daughter falling sick of the sweating sickness. She could not be awakened by doctors. After praying, it came to Thomas More. There straightway it came into his mind that a clyster would be the one way to help her, which when he told the physicians, they at once confessed that if there were any hope of health, it was the very best help indeed, much marvelling among themselves that they had not afore remembered it. In the 18th century, tobacco smoke enemas were used to resuscitate drowned people. Tobacco resuscitation kits consisting of a pair of bellows and a tube were provided by the Royal Humane Society of London and placed at various points along the Thames. Clysters were a favourite medical treatment in the bourgeoisie and nobility of the Western world up to the 19th century. As medical knowledge was fairly limited at the time, purgative clysters were used for a wide variety of ailments, the foremost of which were stomach aches and constipation. Molière, in several of his plays, introduces characters of incompetent physicians and apothecaries fond of prescribing this remedy, also discussed by Argan, the hypochondriac patient of Les Malades Imaginaires. More generally, clysters were a theme in the burlesque comedies of that time. According to Claude de Rouvroy, Duc de Saint-Simon, clysters were so popular at the court of King Louis XIV of France that the Duchess of Burgundy had her servant give her a clyster in front of the king before going to the comedy. However, he also mentions the astonishment of the king and Madame de Maintenon that she should take it before them. Alternative medicine. In the 19th century many new types of enema administration equipment were devised, including the bulb enema. Later there came to be a device to allow gravity to infuse the solution into the recipient, consisting of a rubber bag or bucket connected to a hose with a nozzle at the other end to insert into the patient's anus, the bag or bucket being held or hung above the patient. These continue to be used, although rubber has been replaced by modern materials and the bags, at least in hospital use, as disposable. In the late 20th century the microenema was invented, this being a disposable squeeze bottle with contents that cause the body to draw water into the colon, e.g., sodium biphosphate or glycerin. Colon cleansing. Nutrient enemas were administered with the intent of providing nutrition when normal eating is not possible. Although this treatment is ancient, dating back at least to Galen, and commonly used in the Middle Ages, and still a common technique in 19th century medicine, nutrient enemas have been superseded in modern medical care by tube feeding and intravenous feeding. The term colonic irrigation is commonly used in gastroenterology to refer to the practice of introducing water through a colostomy or a surgically constructed conduit as a treatment for constipation. The Food and Drug Administration has ruled that colonic irrigation equipment is not approved for sale for the purpose of general well-being and has taken action against many distributors of this equipment, including a warning letter. The use of enemas for reasons other than the relief of constipation is currently regulated in some parts of the United States, while practitioners in other states may go through a voluntary certification process. Coffee enemas. Kellogg's enemas. Recreational usage. The same term is also used in alternative medicine where it may involve the use of substances mixed with water in order to detoxify the body. Practitioners believe the accumulation of fecal matter in the large intestine leads to ill health. This resurrects the old medical concept of auto-intoxication, which was orthodox doctrine up to the end of the 19th century but which has now been discredited. Although well documented, the procedure of inserting coffee through the anus to cleanse the rectum and large intestines is considered by most medical authorities to be unproven, rash, and potentially dangerous. Coffee enemas can cause numerous side effects, including infections, sepsis, severe electrolyte imbalance, colitis, polymicrobial enteric septicemia, procticulitis, salmonella, brain abscess, and heart failure, and deaths related to coffee enemas have been documented. In the Gerson therapy, coffee enemas are administered. Some proponents of alternative medicine have claimed that coffee enemas have an anti-cancer effect by detoxifying metabolic products of tumors, but there is no medical scientific evidence to support this. In the late 19th century, Dr. John Harvey Kellogg made sure that the bowel of each and every patient was plied with water, from above and below. His favorite device was an enema machine that could run 15 gallons of water through an unfortunate bowel in a matter of seconds. Every water enema was followed by a pint of yogurt. Half was eaten, the other half was administered by enema, thus planting the protective germs where they are most needed and may render most effective service. The yogurt served to replace the intestinal flora of the bowel, creating what Kellogg claimed was a squeaky clean intestine. Enjoyment of, and sexual arousal from, enemas is known as clismophilia, which medically is classified as a paraphilia. A person with clismophilia is a clismophile. Both women and men can find enemas gratifying or sensual. Additionally, in men enemas can stimulate the prostate gland, and so, even when a recipient perceives his enema as unpleasant, as can happen in medical settings, an unexpected erection is common. Klismaphiles can gain satisfaction of enemas through fantasies, by actually receiving or giving one, or through the process of eliminating steps to being administered one. An enema can be an auxiliary or even a substitute for genital sexual activity, possibly as a regular sexual activity for one or both partners. Sexual enema play is practiced both heterosexually and homosexually. An enema can also be included in sadomasochistic activities for erotic humiliation or physical discomfort. An enema can be employed prior to anal sexual activities such as anal sex, analingus, and pegging for several reasons: in order to enhance the sensation of intercourse, to remove feces prior to sex, possibly reducing bacterial transmission and risk of infection, to reduce the possibility of fecal material or detritus from sexual activity adhering to the genitals or sex toys used during the subsequent activity. Enemas have also been used for ritual rectal drug administration such as bauch, alcohol, tobacco, peyote, and other hallucinogenic drugs and entheogens, most notably by the Maya and also some other American Indian tribes. Some tribes continue the practice in the present day. Noting that deaths have been reported from alcohol poisoning via enemas, an alcohol enema can be used to very quickly instill alcohol into the bloodstream, absorbed through the membranes of the colon. However, great care must be taken as to the amount of alcohol used. Only a small amount is needed, as the intestine absorbs the alcohol far more quickly than the stomach. Preceding an enema for administration of drugs or alcohol, a cleansing enema may first be used for cleaning the colon to help increase the rate of absorption. Enemas have also been forcibly applied as a means of punishment. In the vastly influential Latin American text Facundo, or Civilization and Barbarism, for example, Domingo Faustino Sarmiento describes the use of pepper and turpentine enemas by police forces as a way of discouraging political dissent in post-independence Argentina. The Senate Intelligence Committee report on CIA torture documented instances of enemas being used by the Central Intelligence Agency in order to ensure total control over detainees. A 365 kg brass statue of a syringe enema bulb held aloft by 3 angels stands in front of the Mashuk Spa in the settlement of Zheleznovodsk in Russia. It is the only known monument to the enema. Notes: a professional nursing instructional video demonstrating administering a cleansing enema. Tabor's Medical Dictionary. K. A. Davis Company. Retrieved July 17, 2014. Pleasure. Sexual. Intoxication. Punitive usage. Monument.